Monash Health is the largest health service in Victoria. Over 45% of our medical staff are women, and our Women in Medicine initiative aims to support, encourage and inspire our women doctors to reach their full potential.
I believe that women actually bring themselves to senior roles in medicine. I think they bring their own skills, their own experience, their own competence, and in fact they bring diversity as well and a different point of view.
I think the first thing and the most important thing is to actually recognise what your personal values are. And then the second thing is to work out what skills you have. And then the third, and certainly not the least important, is what are you passionate about. And when you combine those three things together, I think that's what helps determine the road in medicine that is going to be suitable for you.
There are gender differences in thinking, in culture. I think any organisation, in my experience, benefits from having a good spread of both men and women in senior roles.
There were several keys to success, perhaps in my career. A supportive partner was very important. We share the parenting of our children and are equally responsible at home.
I would be lying to say there weren't difficulties along the way, and we have had to both work very hard at work and at home.
It's really important to know what you want to do and persevere and not give up. It's important to see obstacles as opportunities for learning rather than blockages.
It's a good idea to find a mentor, but she should never doubt her ability.
Technical expertise does not make you a leader. It doesn't make you a good manager, and we need to have the opportunity to build those skills.
Today we've sort of moved into what we call a multi-mentorship, and I guess that's the sort of model that I've grown up with, where every interaction is a potential learning experience.
I've never met a senior medical staff here who's not been encouraging and supportive. They all have a love for teaching, and certainly on the rotations that I've done, I've always felt encouraged and taught and supported.
Juggling family and career is a constant challenge, not impossible, but a challenge.
It's vital to remember what's really important. You can't do everything, so you have to outsource the things that you don't have to do.
The most important thing is understanding the difference between quality time and quantity time. To invest in quality time means when you're with your children or your partner and your friends is actually being truly present.
But let's not forget that we just assume that men can have families and careers, and many men want to have more time with children. So it's not women are peculiar in that regard.
I look at our organisation, we've got a chair of the board as a woman, the CEO of Monash Health is a woman, and the Dean of Medicine at Monash University is a woman. When I look at the three women there, it makes me very optimistic for the future of my three daughters, that they're going to come into this world where every opportunity can be afforded to them.
I think the picture for women in medicine has already improved quite markedly. I think it's really up to the younger people now to get involved, to take on leadership roles. So in fact they themselves will be the next drivers for change.
So with this initiative, we hope to provide support and access to leadership training so that when it comes the time to apply and compete for leadership positions, women feel ready and confident.
Women and men inherently think of things from different perspectives, and having that combined perspective is what gives the greatest outcome.
There are some women who make a choice early on because the barriers are just too hard. And that usually relates to being able to juggle the training and or the early career with family. But I don't think women should ever think that they shouldn't go for the top job.
The Monash Health Women in Medicine initiative is not about promoting women into traditional leadership roles on every scenario. It's about engaging and inspiring people to reach the potential and to get to the job satisfaction that they want to achieve.
I've had a wonderful career. Yes, it does come at some costs, but it's been very rewarding. And now, in fact, you know, I'm getting older and I have 3 children that I still talk to, and I have 8 grandchildren who I enjoy, and I've been incredibly fortunate.
I'd suggest that success in life is more about getting a balance for you, your partners, your family, and really that's around thinking through what you want out of life.
My advice would be to absolutely believe in yourself and be out there, volunteer for things, because then next time around she'll be the one who's asked.
As the Director of Medical Services and as a woman, I feel extremely privileged and proud to be part of that exciting journey and be part of the change that women in medicine will bring.